The Inclusion Desk is presented as part of Move to Include, a partnership of WXXI Public Media and the Golisano Foundation.
Hi, I'm Noelle Evans with WXXI News. Thank you so much for joining me for this Inclusion Desk Forum, Strengthening Social Skills in a Pandemic. The Inclusion Desk is part of WXXI's Move to Include, an initiative which encourages thoughtful discussion about issues related to inclusion. I'd like to welcome my guests, and as I do, I'll ask each of them to describe themselves for members of our audience who are blind or visually impaired. I'll start. I am white, female, and in my early 30s. I have shoulder-length brown hair, and I'm wearing a dress with a flower pattern. Joining me remotely is Emily Goldsmith, Director of Communications for New York State Senator Samra Brouk. Brouk is the chair of the Senate's first Mental Health Committee, and she recently sponsored a bill that was signed into law in July that changes public health policy for children's camps. Welcome, Emily. Please describe yourself.
Thank you, Noelle. My name is Emily Goldsmith. I work in the Senator's office. I have shoulder-length red hair, Caucasian, wearing a blue jacket and a pink blouse.
Thank you. Also joining me is self-advocate JD Flores. She has a background in disability justice. JD, I'm so glad to have you with us. Please describe yourself.
Thank you for having me. Like Noelle said, I'm JD Flores. I have black glasses, black rimmed glasses. I'm wearing my hair in a ponytail. It's also black, and I'm wearing a white t-shirt, and I am sitting in front of an orange wall.
Thank you. And Jen Hackett, Executive Director of Camp Puzzle Piece and Director of the Community Connections Day Camp, which both serve children on the autism spectrum. She is also a special education teacher. Jen, I'm glad to have you with us. Please describe yourself.
Hi, I'm Jen, and I have long blonde curly hair, and I'm white, and I am wearing a blue shirt, and I am middle-aged.
Thank you. Jen, I'd like to start with you. The pandemic has disproportionately impacted people with disabilities, including those with developmental and intellectual disabilities. How has the pandemic affected your students' social and emotional learning?
Well, for some kids who struggle with social skills, or some individuals, they have not had those opportunities to practice those. So whereas kids were doing Zoom classes and doing work, working on their reading and math in a different format, it's very challenging to work on social skills in the format of doing online learning. And then we take into masking and 6 feet apart. So there were so many pieces that kind of changed how people socialized. And that really impacted many of our kids.
Thank you. JD, Jen was just speaking about young people. Do you find some of those challenges resonate with adults who have developmental and intellectual disabilities?
I think in terms of the pandemic, yes, I think that, you're limited now because you're concerned about being sick, places to go. And so on an average day, you're worried about accessibility and all the other things that you have to navigate. But now you're also having to navigate, did I wash my hands enough? Should I not touch my face? Who am I around? And what does that really mean overall when we're looking at the healthcare system? If I was to get sick, am I really going to receive the services that I need? We've heard a lot of different things in terms of, medical rationing, in terms of what can happen to people with disabilities. So I think it's just really complicated at this time, I would say.
Absolutely. Emily, when constituents reach out about these issues, what are some of the main concerns your office is hearing?
Thanks for asking, Noelle. And I think JD said it perfectly. A lot of it is about the accessibility and the concern that folks have that they may or may not be receiving the care that they're entitled to, whether that's knowing, what resources are available for them, what clinics are available that are truly accessible, not just saying they're accessible, but actually being accessible. And I think that's a big piece of the puzzle, right? When we're talking about especially heading into what may be, another wave of a variant, people are concerned. And I think that's really what we're working to respond to.
Hmm. Now, Jen, at Community Connections Day Camp, I understand the goal there is to teach social skills in a rather direct way. And I know we're also talking about healthcare as well. And, with social skills and socializing, it seems like that is sometimes a secondary sort of component to our overall health. But with this camp, could you explain this process a bit of how to teach those social skills in a direct way?
Sure, I would love to. So Community Connections is a day camp, and we use a format for teaching social skills that's called skill streaming. We partnered with the Summit Autism Academy in Buffalo, New York, and we're trained by their staff. And we started about 5 years ago with Community Connections. And it's a small program. And what we do is we teach explicit social skills. And it could be greeting someone, and then the kids will practice. We'll talk about the steps when you meet somebody, what you should do. Then we practice the steps, we learn the steps, and the kids get up there and they role play them when might be a time in your life when you might greet someone, and then they could do lights, camera, action, and they go up there and they practice their skills. And then after they do this skill, they will play a game, and that game has something to do with meeting someone or introducing someone, whatever the skill may be. So every time we teach a skill, the skill is followed up by an activity where they're practicing the skill. And we feel this is important because so many times in school, kids will learn skills in a school setting, but when mastery occurs, when you demonstrate those skills across settings. And so we love that we do outdoor activities and outdoor camps like our Community Connections, and kids get an opportunity to go and practice those skills in a different setting. So it doesn't just feel like it's school. And this year, this is our second where we ran the camp completely outside. We did it last year because of COVID, but we found that the kids just loved it so much that we kind of turned the slant to do more of an environmental education type of social skill camp. And we were outside, and even though we had those rainstorms and whatnot, the kids just loved it. And they just loved being outside because it didn't feel like school, but they were still working on those social skills. So it's just really something cool to see.
Sure. Now, I should back up and explain a little bit of why it is that we're having this forum to begin with. When it came to once vaccines became available and people were starting to sort of reemerge into society, or this sort of reentry, for me, I noticed that there were some unexpected challenges for myself. And I can imagine that other people, everybody has their own experience. And so that's what brought me to look into, for instance, your camp, Jen, Camp Connections or Community Connections, and being able to work on those skills. Now, JD, I'm wondering, what do you make of this approach?
I think it varies, depending on the person, depending on the diagnosis, depending on the severity. I'm not an autism expert. I think that being social is super important, especially as you age. We know scientifically speaking that we need friends in order to live a longer life. So having those skills is super important. And what we saw happen during the pandemic, especially early on, is that a lot of children were missing out on services that were really helping them, improve their quality of life. So if anything can slow down regression, can improve someone's quality of life, I'm all for it. It's really beneficial, and that's what you need. My sole concern as for the work that I do is for those individuals with intersecting identities. What does that mean for Black and Brown kids who may not have had access to this kind of camp, or may not have known, their parents? A lot of stuff for parents with, who are part of the DD realm, it's a lot of word of mouth. So, if now that we're not being social with each other, how do we ensure that, it's an equitable process when we're opening these kind of opportunities to folks? Because what we see is for Black and Brown kids who have autism, they don't always have access to these kind of camps. So for me as an advocate, I would say that the highest concern of that is, yes, that's a great opportunity, but is that opportunity for everybody? And if it isn't, how do we change it so that the next go round, like we have multiple sites, how do we find the funding to make it so that it's at multiple sites, so that it is something that can be beneficial for everyone all the way around? Because ultimately we all need friends. Like it doesn't matter where we are, where we fall in life. And that is something that is super important, especially as we build community, which is what we're trying to rebuild now.
Sure. Do you have more ideas of how to make something like this more accessible to other folks?
I think that partnering so in Rochester, I can't speak for Buffalo. I don't know. I'm not from Buffalo. But in Rochester, there is a school, 29 school is predominantly where kids with disabilities go. I think partnering with the population of the school, the kids that go to this school specifically, and informing them that this camp exists, that this is something that they can pursue, could be beneficial. But then you also have to provide transportation. Transportation is one of the biggest issues for people with disabilities. So if ultimately all of this will need lots of money. Like I'm not pretending like I don't understand that funding is a huge issue, but I think we also have to look at, the way certain services work within our city with the Office for People with Disabilities. What is it that they're willing to cover? What is it that they aren't willing to cover? If we can get them in self-direction, which is another program that helps families, fund services. If this is something we could find different streams to make it happen and make it work. I think it's a matter of looking at all the ingredients that you need to kind of make this pie, and what are the ones that we haven't tapped into that, could make this pie, taste the best.
I like that analogy. So I was able to speak with one of the Community Connections campers, Dylan Balsamo. He's 15 years old and describes himself as funny and kind. I'd like to share part of our conversation with you. Here it is. So how many years have you been going to this camp, Community Connections?
5 years.
And what was it like this past year?
About Community Connections, pretty good. I made some friends. I got to have fun. We played games. And it was pretty, and we also got to go on the playground, which was awesome.
How is that compared to previous years?
Well, I think all the years have been pretty good.
And what do you learn at the camp?
Made friends, and we played games, and we got to learn stuff like about interacting with people and making good decisions.
What sort of skills were your favorite to learn?
I think it was the ones where you were being nice to people. Because it's always nice to be nice to someone.
How did it feel for you practicing that skill?
I felt happy.
It seems like a pretty good win-win skill once you get it.
It is.
And with things like Zoom or video calls, do you find it challenging or anything like that when it comes to practicing some of these skills?
Not really, once you get the hang of it.
This might be a question for Dad, but for both of you, why go to this camp specifically?
Because it can help kids interact more.
I think Dylan just touched on it. So we were faced with a choice 4 years ago. We had a great dialogue with his school about summer school through the school versus Community Connections. One takeaway was the social interaction, which is the most important. So keeping Dylan in routines seems to help, which curriculum that they develop in Community Connections does that. But more importantly, it's that social interaction. It's learning everything from how to have appropriate conversations to how to correctly answer questions, but more importantly, how to work through challenges. And when Dylan gets frustrated and he can't verbalize his frustrations, you have to use techniques to help yourself work through some of those challenges. And that's what the camp does. That's what the camp specifically is designed to do.
Sure. Dylan, does that sound true to you?
Yep, it does.
What have been some of I don't know if you think of an example of having to work through frustration or anything like that? Any wins there this summer?
Well, we've done pretty good. I've learned to be more calm and try to keep my cool. I get frustrated when things go wrong.
Well, thank you both so much for taking the time. Dad, any other thoughts you'd like to share?
No, that's it. We're just equally as excited for him to get back. We're excited for the next chapter for him in high school. And we appreciate you taking time for us today.
Jen, you've seen Dylan at this camp for 5 years. What has his progress been like, and how has the program benefited him?
Well, it's just great to see him grow, and I'm so proud of him because now he's like, well, next year I really want to be a counselor. So it's really cute. But it's great to see how, sometimes, and when the kids are younger, they don't always see the value of working on the social skills because they are a little bit more withdrawn and into what their own interests are. And as they go through adolescence, they start to look at the world a little bit differently, going through puberty, going into high school, and they start to change. And it's been really great to see him change. And then all of a sudden say things like, I want some friends. And I know with the complications with COVID and people having to adjust, one of the things I think some kids learned was that they didn't like being alone as much as they thought they did. And so it was really cute this year to see, and I taught virtually the whole year. So when I started camp this summer, it was the first time I was interacting with kids live, and I'm sure the kids were thinking like, why is Miss Jen so enthusiastic? But I was so excited to be back with live children that were not so virtual. So, and I saw that in them too. And just watching, Dylan interact and want to participate so much. And it was really cute to see.
Now, recently, state public health law changed in a way that makes it easier for children's camps like Jen's to hire certain healthcare providers, including mental health and speech therapists and social workers. This goes for day camps, overnight camps, and traveling camps. Emily, Senator Brooke sponsored the bill that put this into motion. Tell us more about it and why the senator felt it was important to make this change.
Yes, absolutely. Thank you again for asking. This legislation really is aimed at making sure that every child, no matter their level of ability or standard definition of access, has that access to a camp, to that same experience, that community building that we've heard from our other panelists. What we have found is that summer camps are not just these like sleepaway camps that maybe we see in movies where kids go and have a great time, which is also a big piece of it, but they also do amazing work for students that may be on the autism spectrum, that may be living with other types of, whether it's learning or developmental disabilities, excuse me. And I think where we run into problems is that as of prior to this year, the legislation was such that summer camps couldn't employ folks like mental health professionals, like chiropractors, physical therapists, speech therapists, and that kind of law legislation doesn't serve anybody. That doesn't serve the needs of New Yorkers. That doesn't serve the needs of this community. So we saw an opportunity to change that, and Senator Brooke was a big advocate in Albany for making sure that all students were able to, have an equitable shot at a fun, safe summer.
Could you explain a bit? When I was looking at the legislation before it was changed to now, it seemed as though it was just the lack of that language to say, and social workers and speech therapists. Why does it need to be explicitly stated in legislation in order for this to become available?
That's a really great distinction, and I'm glad that you asked, because actually prior to this legislation, it was arguably a felony for summer camps to employ medical professionals or to employ folks like that I listed before, like social workers or speech pathologists or mental health professionals. And, you know, our office worked very closely with summer camp directors across the state, really, to understand, really, is this law needed? Are we really just adding names that, you know, is it superfluous? Do we need this? And we found that, you know, there really is a clear need, because unless the director of a camp has this knowledge, like Jen does here, we may or may not be sending our kids into a situation where they just don't have the resources that they need. So it became apparent very quickly that this is something that needs to change, and it needs to change now.
Jen, would this change anything for the camps that you oversee?
I think it would. And it goes back to talking about that, making things equitable and having us being able to bring on board a social worker or someone who could help to facilitate, to help families that might have challenges to get to camp. Because really we are, you know, I'm a teacher, I'm not a social worker, I'm not a school psychologist, and I have a lot of skills after all my years of teaching, but having somebody that knows the system better than I, as far as helping families to get services, would be a huge part of helping for more access to our programs. And really getting access. We do our best, but we don't have the skills that somebody who's a social worker might have. And that would be really a great addition to our staff.
Sure. JD, what do you make of this state law change?
I mean, it's hard, right? Because in my humble opinion, while Jen's camp is amazing and it's great that it exists, it takes a long time for these kind of camps to come down to where I live, where the city kids can go and can enjoy. So, you know, this law is great because you can, yes, you're approving more resources, but are the city kids getting access to these resources? Are they getting access to these camps? I didn't go to summer camp until I was old. Like I was like 11, 12. So I didn't get to do this like when I was younger. And it was like by happenstance that my mom heard it from someone, and I went and I was able to go. This camp doesn't exist anymore. I believe it's called Rotary Sunshine now, but I went to Hakamo, which was a camp specifically for kids with physical disabilities, right? And so everything you needed was there in terms of accessibility, and it was, you know, it was designed for kids with disabilities. So like for me, while the law is beneficial, it's only beneficial to a certain extent if it isn't, you know, something that is presented to the kids that live in the city who would benefit from even making friends at summer camp, right? Like you make your friends at summer camp and you can't wait to go back to that camp because you see these people once a year and you're like, oh, like, you know, this is the week that I'll get to spend with such and such because I haven't gotten a chance to see them before. So but I don't know how many of the kids in my city actually get that opportunity. So like I said, a lot of this happens by word of mouth. So it's bigger than just creating space to hire these professionals and these resources. It's also about finding a way to make this more accessible so that people can actually access it. So how can they participate? How can they apply to the camp? How do we ensure that the wait lists aren't so huge that their name never gets picked where they can go to the camp? So how do we, you know, also create a realm that, you know, people can really participate and enjoy?
That's a really good point. JD, last year, you and I spoke briefly about the documentary Crip Camp, which is about Camp Jened, which was back in the 1960s and 70s. It was specifically for people with disabilities, and it was sort of a springboard for a lot of the activism that we saw thereafter. Why was it important to you to talk about this documentary?
I mean, it's the first of its kind, right? Like how often, like it's the first of its kind, but also how many other camps really exist like that, where people were free to just be themselves. One thing that you get to see in Crip Camp is that people just existed, right? They didn't have to put on a show. They didn't have to, you know, work hard to be accepted amongst their peers. Like they just were, right? Like you couldn't bathe yourself, somebody jumped in to help you, and no one was looking at you funny saying, oh man, you couldn't do that. Like, and so you saw people who were like really, really disabled. Like it was a continuum. Like it just, the variety of disability didn't matter. And so you got the opportunity to be the cool guy on campus, or to have all the friends, or to even create relationships and to have a girlfriend, a boyfriend, whatever. And so those aren't opportunities that people with disabilities get often, in my opinion. And so that's why Crip Camp was so important, to show people that we are just people. And so the personhood that was shown through all of this film was super important. And that's also why the camp within itself was important, right? Like you saw people smoking cigarettes, you saw people, you know, talking, joking, and they were just being people. And so we don't see that often. Often what we see in the media when it comes to people with disabilities is we're learning some sort of lesson, or, you know, we're the teach back moment in the film or something, and or it's the inspirational portion of the film. And that's not what Crip Camp was about. It was more so for you to see people being people and fighting for their rights.
JD, do you have any thoughts as we start to wrap up here about ways to better support people with disabilities through the pandemic and after?
I mean, my fear is that we've learned nothing, and that we keep pushing, we keep saying we want to go back to normal. We keep saying this, and that makes me nervous because, you know, the pandemic opened the doors for all types of accessibility, right? And it changed, even look at us, right? I didn't have to figure out transportation to get to the news station to speak with you. Like it was something we were able to do on Zoom. I'm in the comfort of my own home. I don't have to think about where I'll use the bathroom or anything like that because I'm home. So for me, it's really, we continue to push forward with all these new ways that we found that work for people. You know, we continue to be innovative and how to make things work. And we should be really leery about saying we want to go back, because what are we really going back to? And I think that in particular for people with disabilities, we need to be conscious of what these legislations, what these policies say, how they really benefit folks, how the money really trickles down, how the money really works. Because ideally, you know, for me as an advocate, what I would love to see is everyone having an opportunity to be employed and to just live the kind of life that they want to live, or live in the places that they want to be. So how do we continue to ensure that people have the opportunity to do that? And so when we say go back to normal, I think we really go back to the drawing board and look at what worked for us during the pandemic in the best way, and what didn't, and how can we improve on that? I don't know if that really answers your question, but that was like a roundabout way.
I think
I have lots of thoughts.
And it also seems in a lot of sort of on the outskirts of what we're talking about, but just to hit on it, is the need for community and the need for building these connections, and how socializing isn't just some sort of folly. It's part of, you know, building on our wellness. And as you said earlier, JD, it's, you know, it can also speak to our lifespan and the quality of our life. Jen or Emily, do either of you have any thoughts that you'd like to share?
Well, I would love to just piggyback on what JD was talking about, of just being yourself. And when we have our community connections, which is a local camp, but we run a program where the whole family goes away, and that is that's a camp. We take families to the Adirondack Mountains, and they go away, and the kids play in the waterfront, and the parents are there, and all the siblings are there. And that was our original program that we started with. And that is just about being yourself, and being parents, being able to connect with other parents, and siblings connecting with other siblings, and just being who you are and having fun. And we know that, you know, sometimes there might be an issue or somebody's having a difficult time, but everybody just rolls with it. It's like, yep, well, that might be me in the next hour, somebody's thinking. And really the bond that all of those, the siblings and the parents make too, is really precious, because they realize that they're not in this alone. And I hope that one of the things that people learn through going through this pandemic is, when people were isolated, now when people are coming back together, and that how important those relationships are, and those friendships, and how to value those. And what I'm seeing now is kids seeing the value of that. Like, yeah, I want to have that because I missed having those people around me. And I saw this summer just a little bit more kids working a little bit harder to coming up and saying things like, I need to work on my frustration. And I'm like, we can do that. So it's just cute to have them recognize and ask that they want to do this because they want it. Because when people want to make changes for themselves, it's so much better than teachers forcing things onto kids. And it was just really cute this year to see kids be that excited about it.
Emily, any thoughts that you'd like to share?
Yes, sorry to take myself off mute there. Yeah, I want to go back to this conversation, this mini conversation about just the true accessibility of it all. I think that, we could have the best legislation in the world, we could have the best camps in the world, we could do all of the things, but none of that matters if the people that need it can't access it. And I know that I speak for Senator Brooke and a lot of her colleagues when I say that that's a priority. That's a priority for this Democratic conference. That's a priority for our Rochester delegation here. And, as we continue to look for ways to make things more accessible, whether it is expanding who can work at a summer camp or expanding the kind of resources that are available post-COVID or creating a mental health committee in response to this pandemic, we want to hear community input. We want to hear what the community needs, because the best folks to really, inform those decisions, it's not necessarily folks in Albany, it's folks in the community that see what happens on a day-to-day basis that can really say, this is what I'm seeing, this is what I'm living, and this is what I think needs to be done. So I would encourage, any of your viewers or listeners to reach out to their representative, whether that's our office or, our colleagues in the assembly or other colleagues in the Senate, and really say, like, this is what my community needs, and speak up, because there are people that want to listen.
Thank you so much, Emily. So some of these habits that some of these campers might have to sort of be in their shell or be in a cocoon is, from my understanding, is a way of, staying safe. And after so much time of isolation, I can imagine that habit isn't always as helpful in the end. And so I'm glad to hear what you're saying, that more and more campers are willing to take that step to take on those challenges for their social well-being. So that concludes this edition of WXXI's Inclusion Desk Forum. I'd like to thank my guests for taking the time to be here together, Jen Hackett, JD Flores, and Emily Goldsmith. It's been wonderful connecting with you all. The WXXI Inclusion Desk is part of Move to Include, a partnership to encourage thoughtful discussion about issues related to inclusion. I'm Noelle Evans. From all of us at WXXI, be well and take care.
This has been a production of WXXI's Inclusion Desk, part of Move to Include, a partnership of WXXI Public Media and the Golisano Foundation. Learn more at movetoinclude.org.